Good day, ma'am. My name is Zaya Roberges, and today I'm going to be performing the cleansing bed bath to the patient. So, cleansing bed bath is a type of bath given while the client is on bed. So, the purpose of this is to provide client clean and feel comfortable, to increase sense of well-being, and to promote muscular relaxation and relieve feelings of fatigue. So first thing to do is we're going to assess the client's tolerance for the activity. So the rationale for this is to determine the client's ability to perform self-care and level of assistance. So next is we're going to adjust room temperature to prevent rapid loss of body heat during bathing. And then provide privacy by drawing the curtains and closing the door. It is to allay fear and anxiety to the patient. So next is we're going to explain the procedure to the patient to promote client's cooperation. And then we are going to offer bedpan or urinal to the patient so that client will feel more comfortable and allow continuity of work. Next is we're going to wash our hands and wear gloves. It is to reduce transmission of microorganisms. So next is we're going to lower the side rail near you and assist the client to the side of the bed where you will work and have the client lie on his back. Next is we're going to loosen top covers of foot of bed. Place the bath blanket over top sheet. And then instruct the patient to hold the bath blanket. And then fold and remove top sheet behind the blanket. If the top sheet is to be reused, fold it over a chair. If not, place soiled linen into a proper plunder basket. And be reminded, do not allow linens to touch to your uniforms. And next is we're going to remove the patient's gown while keeping the client covered with a bath blanket. If the patient has an IV, remove first the arm without the IV. Important reminders, do not disconnect tubing. Remove patient pillow. So removing pillow, make it easier to clean the patient's ear and neck. Place patient in a semi-folded position. Spread a bath towel to the patient's chest and tucking it into the patient's chin. So we have here our two basins. We are going to put hot and cold water into the both basin. Check the temperature. All good. And then we're going to need soap in one basin with water. And then we're going to need 2 towels and immerse it to the both basin. So the basin without soap, we're going to make a meat. And gently wipe it to the patient's eye from inner canthus to outer canthus and different sides. And then immerse again the small towel into the basin without soap and wipe it gently with an S motion. And use a clean cotton balls to clean the patient's nose. In different sides or different cotton balls into different nose holes. Next is the patient's ears. Wipe it into different sides of the small towel and repeat if necessary. Next is the patient's neck. So for the patient's ears and neck, we're going to wash it as what patients prefer. So next is we're going to put a bath towel to the patient's arm far away from me or to the caregiver. Use a water with soap to the patient's arm. Make a mitt and apply to the patient's arm from distal to proximal in the different sides of the mitted towel, including underarms of the patient. After that is we're going to rinse the patient's arm. And pat it to dry. And then immerse the hands or the fingers into the basin with soap and water. And rinse it without soap. And then pat it to dry. And then repeat procedures to the patient's other arm. Place bath towel into the patient's chest. And then fold the towel in the chest part, the bath blanket in the umbilical area. And then wipe the patient's chest with soap and water from chest to abdomen. And then rinse and dry. And after that is we're going to change the bath water. And then expose the patient's farther leg. And place a bath towel to the patient's leg to protect the linens from getting wet and also to provide warmth and privacy to the patient's leg. And wash leg with firm long strokes from distal to proximal with the towel different sides and make sure to include the groin. And then rinse it. And pat it to dry. And immerse the foot in the basin with soap and water. And rinse it. And then pat it to dry. And then remove the towel and cover the leg. Cross the patient's leg underneath the bath blanket. Instruct and position the patient into side-lying position to wash the patient's back. Roll down the bath blanket, but always make it sure to cover the patient's back. And put a bath blanket to its back for drying purposes. And then wipe the patient's back with soap and water. And rinse it. And then pat it to dry. After that, we're going to lay our patient's back to its supine position, the count of 3. And then position the client's leg for perineal care. So we're gonna need 7 cotton balls. Wipe pubis area in a zigzag motion. And then discard. And for the legs, also zigzag motion. And for the other, zigzag motion. And then for the labia, 1 stroke down to its anus, another side, and another one for straight down to anus, and another one. Then discard. And then ask the patient if the patient wants some water for her perineum. And put some antiseptic to protect the patient's perineum, especially when doing surgeries, and make patient comfortable. And then change patient's gown. If the patient has IV, insert first the hand with the IV. And then place patient's pillow, and then protect pillow with towel. And then we're going to groom the patient's hair. And then next is we're going to change the bed linen or the top sheet. And then remove the bath towels underneath the top sheet. And then groom patient's fingernails. The next is we're going to remove all the equipment used and store it in a proper place. Next is we're going to remove our gloves, and then wash our hands and discard the gloves into a proper bin. And then lastly, we're going to record the procedures that is done to the patient. That's all, ma'am. Thank you.